Joining us tonight here on the show is Dr. Navarra Rodriguez, the President and Chief Medical Officer of Advantage Care Physicians. We are so grateful you are here tonight to answer our viewers' questions.
Well, thank you, Jessica. I'm pleased to be here as well. I lead a large primary and specialty care group, Advantage Care Physicians, and we have 400 providers serving patients in 38 locations across New York City and out onto Long Island. And it's so important to engage with patients in the community to make sure they're knowledgeable and empowered as we face the COVID-19 crisis. I'm very pleased to know that our practice has been serving in communities that have been hard-stricken for many, many years and decades. And our focus has been team-based in making sure that we engage with patients so that they're educated and know how to get care and have their questions answered. We've done a lot in the practice to make sure that patients have access to care that's virtual or in safe environments. And we want to make sure we're protecting our patients, our staff, and the communities so that we can make sure New Yorkers stay healthy.
Yeah, and part of that virtual care is you being with us tonight. So thank you so much for being here again. Before we get to our viewers' questions, though, I do obviously want to give an update on where we are at tonight. Governor Cuomo applauding all New Yorkers for doing their part to slow down the spread of COVID-19, saying hospitalizations and ICU admissions have been trending down on a slight basis. However, people are still testing positive for this virus. The State Department of Health reporting at least 213,779 COVID-19 cases across the state. New York City making up 118,302 of those positive cases. And new today from the governor, he's issuing an executive order requiring New Yorkers who are going out in public and cannot practice social distancing to wear face masks. So, for example, if you're going on a crowded public transit train or bus, or if you're walking on a busy sidewalk, you are required to wear a face mask if you haven't already, because really, as I go out and about, because obviously being an essential worker, coming into the studio every day, I'm on the trains, I'm on the sidewalks, and really everyone you see has been wearing a mask, which is super encouraging. But again, getting that executive order by our governor today. So again, Dr. Rodriguez, thank you for sharing your time with us. I know you physically work and see patients at the Washington Heights office, which has a lot of people that live in the Bronx, which are a lot of our viewers. So again, we're lucky to have you. Let's get to a social media question, because we have been getting so many of those, obviously, on a daily basis as things are changing. Our first one here coming in from Instagram, saying, how soon can a person who was infected with the COVID-19 can be retested if there is retesting available?
You know, that's a great question, and the question of the hour is how to get access to testing and what kind of test is being performed. There are a lot of ways that we test patients. The most common test that's performed in practices like ours and in hospital settings are tests to see if there's an active infection for a patient or a person who's presenting with symptoms, and those tests are usually directed to healthcare workers, first responders, and people who have comorbid illnesses or higher risks for the disease. We haven't yet had broad testing to see patients who've had symptoms to see have they developed antibodies to prove that they're immune to the virus. I expect over the coming weeks we will learn more about testing to demonstrate immunity. But a lot of the testing right now has been focused on active cases, active infections, and those folks who are at the front lines or have significant illnesses that put them at risk.
And you're right, it really is the question of the hour. We've heard specifically in the past week from so many lawmakers in the Bronx and Brooklyn. We know those two boroughs have been hit really hard, and specific communities within those boroughs for more testing. We know we're getting a couple more sites in the Bronx, and we're just waiting to hear on where. So obviously, thank you for your insight on that, and we are all thinking the same thing to that Instagram question. So let's get to our second social media question here. Can COVID-19 COVID-19 virus attack other organs like your heart, specifically if you have an underlying condition? Additionally, can you possibly review RA and possible COVID-19 complications? Thank you.
A multi-layered
yes.
question. You know, we do know that people who have other chronic conditions or comorbid conditions like diabetes, COPD, asthma, heart disease, and other autoimmune conditions can be susceptible to the virus. I think a lot of work and studies are being done now to see how the virus itself is affecting organs in the body. We know that there are significant pulmonary complications and pulmonary symptoms with this virus, but there's still a lot that's unknown about the long-standing effects that the virus will have on the human body, and especially those who have chronic conditions like RA and diabetes and heart disease. So more to learn and more to come. But certainly we want people who have those chronic conditions to be in contact with their primary care providers and specialists to understand how they can protect themselves and monitor their symptoms and any after effects if they happen to become ill.
Right. And just kind of going off of what we did learn today, kind of the big message from the governor, that new executive order about ordering anyone who is going out and about and in a situation where you might not be able to social distance to wear a mask. How important is that at this stage in the game and what we know about this virus and how it's spreading?
I think, you know, anything that we can do as individuals and New Yorkers to protect ourselves and to protect our communities is important. So social distancing is huge and tremendous. And a lot of the progress that we've seen over the past week in flattening the curve has been because of those significant measures for us to limit crowded spaces and to avoid contaminating others. Wearing a mask is just another measure for us to demonstrate that we are protecting ourselves and protecting the community and trying to avoid any spread of respiratory droplets if one were to cough or sneeze or be around others.
Yeah, just another way. And if you don't have a mask, again, you know, you see people with any, you know, a bandana, really anything that you can cover your face with at that moment.
Yes, anything that covers the nose and mouth area, I think, is helpful in order to be responsible moving forward.
And let's get to our first caller, because I know we have Tommy on the line who's over in Brooklyn. Tommy, can you hear us?
Yes.
How are you, and what is your question from the doctor?
Okay, my question is, I've seen some things on Facebook about our clothing. We should wash our clothing when we should come in from outside, but I don't have access to washing machines just to wash clothes like that. So how long would I say the virus will remain on, like my coat or my hat, from when I come outside? And
you know, Go ahead. Sorry to interrupt.
And I want to know, is it okay to have my windows open since they say we need to be, you know, covered up outside? You know. Is it okay to have my windows open?
So I think we'll take that one. It's okay to have your windows open. A lot of the work and recommendations around social distancing is to avoid people within a 6-foot radius around you to avoid exposure to those droplets. A lot of work and research is being done around how long the virus lives on solid surfaces and clothing, etc. There is less risk that there's transmission of the virus from exposure to clothing. And, you know, I think more risk if there are people who are coughing and sneezing around you or on you on those clothes and other clothing surfaces. If you don't have access to wash, you know, your clothes or the coat, I think just letting them sit, don't handle them. When you come in, put things to the side and letting them sit as long as possible, it would be the recommendation.
And that's great advice, because a lot of people are in the same boat, Tommy. So thank you for calling in with those questions. Let's get to Susan, who's on the line as well, in East Flatbush, Brooklyn. Susan, can you hear us?
Yes.
How are you, and what is your question tonight?
My question is, what it is for home health aides. We got to leave and take care of the patient's home. And they keep talking about the virus living in your clothes and all this stuff. I mean, we don't know what to do.
I think for home health workers, as much as you can, and for healthcare workers in general, when you go to work, using a mask, using gloves when you're taking care of patients. And then when you're coming home, as quickly as you can, remove those clothing that you've worn at work, and, preferably wash them as soon as you possibly can. But making sure that, while you're at work, you're using your mask, your gloves to also protect yourself.
All you can do is just be times 100 careful at work, when you get back from work. That's really all we can do. And we're going to be right back here to take more of your questions. Stay with us.
This News 12 special report is brought to you by Montefiore Einstein. Our governor has asked us all to join the fight against COVID.
Thanks so much for being with us here tonight on News 12. We're joined by Dr. Navarro Rodriguez, who's been taking your questions here and will continue to do so. We've got some callers on the line now. Let's get to Dina from Brooklyn. Dina, can you hear us?
Yeah.
How are you tonight? Thank you for calling in.
Okay.
What's your question?
I want to know when there's going to be a vaccine for this virus.
Great question.
That's a great question. I have to say it will be a while. Most projections are that the vaccines probably won't be available until early next year. But I know scientists are working very, very hard to make sure that they can develop vaccines as quickly as possible to protect the American people.
Just going to have to wait on that. But we know that they're working so hard behind the scenes, really every day for a while now, to make sure that that becomes available. So thank you, Dina. It's on all of our minds, because that will put us all at ease once that becomes available. Let's get to Janet, who's on the line, who's in Crown Heights. Janet, how are you?
I'm okay.
Good. Grateful to get your question tonight. What's on your mind for the doctor?
I have two questions.
Okay.
The question is, I am a mom, and when your child call you from the emergency room and crying and say, "Mom, I'm at the emergency room and nobody helping me," like, what as a parent, what can you do? This happened to my daughter. She went to Brookdale Hospital. The ambulance come and take her to Brookdale Hospital. I got a call 3:30 in the morning, wake me out of my sleep. "Mom, I'm at Brookdale. Nobody's helping me." And they don't have the virus test at Brookdale Hospital. What is going on? What is really going on in this neighborhood pertaining to African American?
There are a couple of things. We know that this virus is a terrible thing, and it has preyed upon communities that have suffered from other conditions. And we know that there are healthcare disparities, that Latinos and African Americans have suffered from this virus, and they've suffered from other things like diabetes and heart disease that make them more vulnerable to this virus. We also know that our city has been overwhelmed, and several of our hospitals have been overwhelmed by patients coming in. Thankfully, the tide is turning, but we know that our hospital staff workers are trying their best to meet the needs of all patients, to prioritize the care of those who've been ill, and make sure that patients can deal with this virus, be tested, and cared for appropriately. As much as we can, we don't want to overwhelm our hospital systems. Those are the places where very urgent care needs to be delivered, but we know it's been a struggle. I think with the opening of alternative hospital sites like the Javits Center, like the SHIP, that helps us relieve some of the stress on the hospital centers in our neighborhoods, especially in Brooklyn. But we know it's been a hard road and a terrible and difficult and frustrating road for many, both patients and healthcare workers alike.
Janet, I'm so sorry that you got that phone call. I mean, I cannot imagine, especially being a mother, being in that position at 3 a.m., getting that phone call from your daughter. So I feel for you. And that is just one story that so many people have felt, that emotion and just trauma throughout this whole thing. And Janet, we're going to follow up with you just to see what else happened, if your daughter has seen anyone now, at least. So we will be in touch for sure. And I'm just so sorry about what you're going through. But you're right on both ends, doctor. It's just been such an unimaginable strain.
It's a strain for everyone and a painful experience for everyone.
Yeah. Let's get to Michelle. I know Michelle's on the line with a question here. Michelle, how are you?
I'm great, thank you.
Good. What is your question tonight?
So my question is, I work in a healthcare facility that we're actively doing testing right now. And in the absence of not having access to a washer and dryer to wash your clothes immediately after getting off the street, if I steam my clothes using a steamer, does it help to kill the virus? And how long would you recommend that I steam each item of clothing?
You know, I wish I could answer that directly. I will direct you to the CDC, the Centers for Disease Control, that has a lot of guidance in terms of temperatures and recommendations for dealing with clothing. I know it's a struggle as much as you can to cover the clothes, especially if you're actively seeing patients at work. Wearing a gown or a cover as well that can be removed at work would be the ideal.
Yeah, and so interesting because we usually get one question usually a night about the clothing that you wear or how long can it stay on surfaces. But tonight it seems, especially from essential workers like that healthcare worker, you really want to make sure you're doing it right because you are waking up again to go back to work. And you want to make sure that obviously everything inside your home and then what you're bringing out is okay. So thank you for all your advice on those questions. And we're going to be right back here to wrap up for tonight's show, but stay with us here as you're going to hear the final words from the doctor. And thank you again for all your questions and for joining us tonight. Stay with us. We want to thank you so much for joining in tonight for our show and calling in with your questions and also sending us your social media questions as well. Dr. Rodriguez, thank you for your answers and your expertise and giving us your time tonight. I know everyone in your field is extremely busy and just tired. So thank you. And what's your final message tonight to our viewers?
I have to say a big thank you. We had several questions from healthcare workers, and I know first responders, frontline workers are doing a great job in keeping our communities going and running and provided with the care and the services that they need. So a big thank you to all of you for that commitment and doing your part. But also, this is a stressful time, and paying attention to one's physical and mental health is critical. So I want everyone to know that practices like ours at Vantage Care Physicians are here for you. We want to connect and make sure you have the supports to keep yourself healthy and make it through this crisis, and think about what we can do to keep you healthy even beyond COVID-19. So thank you for everything.